All right. So like I said, welcome. Thank you all for joining us today for this Covering Wisconsin webinar, helping consumers through the public health emergency unwinding. And we'll talk a lot more about what we mean by that. A training for enrollment assisters. For those of you who may have joined us at the end of May for our community partner mobilizer or outreach focused version of this training, we will be touching on a number of those topics again today. And Caroline is joining us for this webinar as well. But this training will really focus on supporting members through this process and the enrollment assister role, and some tools and resources that you all can use in your role as enrollment assisters. We know we have a broad range of enrollment assisters and other partners on the webinar today. So for that reason, we'll be covering some of the basics as refreshers, but also we'll get into some details as well. So hopefully there'll be something in this training for every audience. And joining us today, like I mentioned, we have Caroline Gomez-Tom, who has recently rejoined the Covering Wisconsin team as our enrollment network and accessibility manager. But many of you are familiar with Caroline. She has many years experience as a navigator with Covering Wisconsin, so is really well positioned to walk us through this training today. And we're so excited to have her back in this new role. And then I am Courtney Harris. I'm the Outreach and Partner Relations Manager with Covering Wisconsin, and just will be serving today as the host and facilitator, helping Caroline manage the question and answer period throughout. And speaking of the questions and answers, we will be using the Q&A feature today. So there is a Q&A button at the bottom of your screen. If you have a question throughout the webinar, please feel free to enter it there. And we will address it throughout as there are opportunities to break if possible. But we also have plenty of time slated at the end to hopefully have a good question and answer session as well. So please feel free to enter your questions in that box. We do not have chat enabled today, so the Q&A feature is where you will engage with those questions. And then speaking of questions, we also have a special guest joining us today. Our partner from the Department of Health Services, Maciel Gomez, is joining us and will be kind of staying in the background, but is here to help us address some questions as well. So thank you, Maciel, for joining us too. And without further ado, I will pass it off to Caroline to get us started today.
All right, thank you so much. Thank you so much, Courtney. Just to test volume, can you hear me all right?
Yep, you sound great.
Perfect. All right. All right, so thank you all so much for participating in today's webinar. And if you attended the one that Courtney and I did just a couple weeks ago, focused toward mobilizers. Some of this will be repeat information, but I hope that the parts that go a little deeper for the purview of an enrollment assister will be beneficial to all. So one of the key messages and really the key takeaway for you all are also the same key takeaways for consumers and partners, because this is information that we are hoping to be sharing widely within the state as we prepare for when the public health emergency ends. And that is, no one will lose Badger Care or Medicaid benefits before the public health emergency ends. And then keeping your contact information updated through the access.wi.gov or calling your local agency, or signing up for push notifications on the My Access app are crucial, with the big emphasis being the access.wi.gov and the My Access app, because we really want folks to focus on doing these things online as much as possible. Also watching for letters from the Department of Health Services on knowing when and how to take action, but knowing that because, and we'll talk a little bit deeper into the presentation about when this is all happening, but because the public health emergency does not look like it will be ending in the immediate future, we just recommend folks watching for letters generally, because people should be opening their mail. So this isn't necessarily the letter that they're waiting for, but just getting into the rhythm of opening letters that they receive from the state, from their Badger Care office, from their HMO, to make sure that they're practicing knowing what to look for, and then also reaching out to you all as enrollment assisters to follow up with any questions they might have. And then finally, getting free local help from you all by calling 211 or going on wiscover.com or some other resources that we'll go through during the presentation as well. But at minimum, this is what we're sharing with consumers and partners. But now we're really talking about why this set aside presentation was important specifically for enrollment assisters. And it's because enrollment assisters are needed to help partners and consumers understand when the public health emergency will end and what actions can be done now. This isn't information that is necessarily just going to be readily available in the community and in the public. There will be promotion, there will be essentially, for lack of a better word, advertisement around when this happens. But it still takes that additional, an additional touch, constant reminders, and really the work that we do out in the community that will make sure that someone doesn't necessarily fall through the cracks. And of course, we share reliable information to the community as it currently stands, and we receive ongoing referrals. So that allows for our partners to know where they can send folks when they encounter someone who has questions. So that's just kind of the opener, but throughout the presentation, we'll make sure that you are familiar with Covering Wisconsin and the work that we do, what to know about Badger Care and Medicaid during the COVID-19 pandemic, action steps for enrollment assisters, and that'll be the big chunk of what we go through, and then other resources and tips and any questions that you all might have. And I know Courtney might be stopping us midway through to address some questions if we get a high volume. But yeah, let's take it away. All right, so Covering Wisconsin is an organization that functions as a nonprofit to help people find and use health insurance coverage. And I like to say find, use, and understand their health insurance coverage. We have health insurance navigators, which are enrollment assisters. We've been a navigator entity, which means we've received federal dollars from the Centers for Medicare and Medicaid Services since 2014 to provide expert health insurance. And we are both federally and licensed by the state to provide that care statewide. And then we also have a wonderful health insurance literacy team that focuses on education, outreach, and promotions of those community tested resources that are also readily available to all of you. And so our navigators provide free help anytime, and that includes understanding health insurance coverage, financial help and finding plans through the health insurance marketplace, also known as healthcare.gov. And I'll be using marketplace and healthcare.gov interchangeably, but really focusing on the healthcare.gov messaging. We'll talk a little bit about that later when we address scams, but we've noticed that when folks will Google information about health insurance, if they put anything in reference to healthcare, health insurance, many times it comes up with sites that might end up causing them to get a flurry of phone calls or just a lot of misinformation. And so we really want to emphasize healthcare.gov and access.wi.gov as the places to go for health insurance information. And then of course, wiscover.com for our partners. But anyways, navigators help address those questions that people might have and help them sign up for insurance through healthcare.gov, Badger Care Plus, or Medicaid, help with billing and coverage issues, and then of course help find other community programs that are available for their health. And just to know a little bit more about where we are, we do serve statewide, and through the pandemic, we've been able to serve statewide, obviously through virtual appointments, both Zoom calls like we're on today and phone, but also we have outstationed navigators through different subcontract partnerships that we have across all of the all the different regions of the state. And I'm glad to see it because some of you may know that I was the Navigator Program Manager back in the day when we originally started. And I remember when we only had 11 counties that we served. And I always hoped that we would be able to serve statewide. And now look where we're at. So, and part of it too is all of the partnerships we have with you all. So thank you for doing this work. All right, so what to know and Badger Care Plus and Medicaid during COVID-19. So knowing that we're talking to enrollment assisters, I didn't want to specifically go over what options are available. I know that many of you are very familiar with Badger Care Plus and healthcare.gov and the marketplace and the different benefits that folks got. So I really wanted to emphasize on really what we're talking about at hand, which is what COVID-19 did to those benefits and what will happen when the public health emergency ends. So during COVID-19, all Badger Care Plus and Medicaid renewals and terminations were paused, which means if someone was found eligible over these last 2 years or so, they were able to enroll in Badger Care, and if they had a change in income, they were able to stay on their benefits and maintain their coverage. And when the emergency ends, and right now it's looking like that might be as early as mid-October, but we will find out in August if that is indeed October, people will need to either complete a renewal or a new application for the first time since they originally enrolled. And so that might be the first time in 2 or 3 years, depending on when their renewal takes place. And at least at current time, we know that there's approximately 1.5 million people enrolled in some type of Medicaid program. So what that means is that there's a lot of folks that will need to renew or reapply. And as we know from doing this work, that many of those folks will need either some kind of assistance, whether it's answering their questions about the application or to the other end of helping them walk through the entire process. And so we want to make sure that enrollment assisters feel equipped to do that as we get closer to this October date. And so here are some of the challenges. When the public health emergency ends, the Department of Health Services will have 12 to 14 months to essentially help folks get renewed or help them reapply. And so members will not automatically need to send in their renewal because if they submit earlier than required, that could result in them losing their coverage earlier than required, and we don't want that. But that also means that there's going to be a lot of information going through and we need to be all on the same page and feel equipped to answer questions of consumers so that folks do not feel discouraged in what will happen with their coverage. Another thing to highlight is that we know that because there's going to be this new information readily available in the community, that folks tend to call the income maintenance consortia call centers or the Badger Care Plus call centers. And we as enrollment assisters are trying to encourage folks to get comfortable with access.wi.gov as well as the My Access app throughout this time as we prepare for that emergency ending, to hopefully not bog down the call centers. Of course, you know, people will need to call if they need to call, but in order to make sure that those folks can get through when needed, it's as much as possible trying to get comfortable using those online options. And then if we start to see trends from the consumers that we're serving, we also have the resource to email DHS Forward Health Partners at dhs.wisconsin.gov to let our community or our DHS partners know what we're seeing in the field, and hopefully get some feedback and solutions so that we don't have to address it by ourselves. And so here are some things to expect when we do get closer to the public health emergency ending. The Department of Health Services will be sending letters to all Badger Care Plus and Medicaid members, telling them to renew or submit a new application, but it will have the date of when they would be expected to renew. And that, like I said, that could be from 12 to 14 months in the future. So when the public health emergency ends, they'll get their notice shortly thereafter. And then it could be that they have to renew in December, but it could also be that they have to renew in, April of the following year, or even November of the following year. So really, it's going to be important for members not to take action at the same time, to know where to go in order to see when they do need to make action. And they'll also be getting a letter closer to their actual renewal 45 days before. And that's when they can decide when to act. So really just emphasizing that what our job is as enrollment assisters is to be aware of this information and make sure that folks feel comfortable with what is happening and that they do not panic. All right, and so as I mentioned earlier, the action steps that Badger Care Plus members can take right now is keeping their address, phone number, and email address current by logging into access.wi.gov. And as of this month, the My Access app is also an option to update your address, phone, and email address. And we're recommending folks to download the My Access app and sign up for push notifications, because that will also allow them to get alerts on their phone so that they know when things are due, when to upload certain verification, etc. And then as a ongoing reminder to have members watch for letters at all times and open their mail, knowing that we're not expecting the renewal notice for quite some time, but there may be other notices that are important to their health care, just for them to be aware of. All right, so that was just the foundation. That was the level setting of the current point in time around the public health emergency. Next, we're going to go into some action steps for enrollment assisters. And I hope that some of this resonates with what you're already doing and working on, and maybe others will be providing other ideas for you to consider. All right, so we're going to go through each of these individually, but these are kind of what I think are the at least key activities that enrollment assisters can be practicing and working on. So as we all do, because this is how we get our name out there, building relationships and communicating with consumers is important, especially when complicated information is going to come out because they trust you. We have regularly, but now more than ever, want enrollment assisters to be having conversations about using care. We should be looking for community events that are happening in our communities, because really the summer is the time to attend and meet with a lot of potential future consumers. One, because people want to get out. Two, we have spent over 2 years in a pandemic that required us to stay indoors. And so the summer, especially a beautiful summer in Wisconsin, is the time to make those new connections with community partners so that they know who to refer to, as well as getting in front of consumers and starting to talk to them now about the coverage that they have. Getting involved with your local enrollment networks, which we'll talk a little bit about, and how to stay informed with policy and information, and really just staying connected with folks that are doing this work, because they're the best folks to bounce off ideas and help strategize on how you could be doing things in your community. Making sure consumers can find you. That's going to be a key thing, because when 1.5 million people eventually need to renew, we will need every single one of you on this call, all enrollment assisters, all including agents and brokers, navigators, certified application counselors, financial counselors, all of the above, to be helping. And so there are some ways that you can make sure that consumers can find you and community partners can refer to you. And then I think the most important ones during this time, and really we've been given the luxury of time with this extension, is practicing using Access. Access.wi.gov does have a training portal, and you as an individual can download the My Access app too, and see all of its features. So how can we best utilize these tools that will help streamline the process for our consumers? So I'll get into each of these. Outreach for the summer. I'm a big advocate for our navigators to be out in the community, especially when our appointments, our one-on-one enrollment appointments are not as intense, because we know that during the fall, we are usually booked from morning to evening with appointment slots. And don't get me wrong, we're still busy. A lot of Badger Care appointments happen, and we still are able to do a lot of special enrollment periods, but there is more flexibility to get out in the community and to talk to folks and make sure that they know when to reach out to us, when to refer their family members, and when to just get connected to us overall. And I think it's an opportunity to share messaging about the end of the public health emergency. Being present in the community helps build trust and name recognition for your organization. It also helps build stronger relationships with community-based partners, because it's usually community-based organizations that are not doing enrollment work that are hosting these types of community events. I also think it's a big benefit because I know some of you have been doing enrollment assistance work since the beginning of the first open enrollment period in 2013, I should say. And if you recall, we used to host our own enrollment events, and those can be beneficial, but if they're just enrollment events, we've learned that consumers don't just show up to get signed up for health insurance coverage unless they need health insurance coverage. And kind of tagging along to some of these, frankly, funner events where there might be food and music, at least gets us in front of a larger crowd. And granted, you're probably not doing enrollment appointments there, but you might be getting them set up for an appointment in the future, or at minimum, doing things like helping them download the My Access app, which really could be an easy activity to be done at a booth at an outreach event, because downloading the app takes just a matter of seconds once you're in the app store of their smartphone. So things to consider. So then there's plenty of resources that are readily available, so you don't have to recreate the wheel. The Department of Health Services has their toolkit specific to the public health emergency ending that you can use and customize to your organization. The next slide also then has the Covering Wisconsin resources that can also be printed off, and Courtney on this webinar is really the person to contact to make sure you can get some of these printed materials if you want them specific to your area. But really, there's already material there. It's not a matter of going to these events empty-handed. And then we also have one of our Covering Wisconsin how-to sheets, actually two of them coming up related to the public health emergency information. One about losing Badger Care Plus or Medicaid health coverage for, post public health emergency ending. And then one about renewing your Badger Care Plus or food share in Access. So both of these resources will be available soon for you to get out into the community. All right, so then the next item that I want to kind of address is talking to consumers about using their care. And I think this is also another one that many of us are probably doing, and an item that I think we all should be doing. So Medicaid benefits allow people to get low-cost medical, vision, and dental care. And we are hearing from some of our enrollment assister partners that folks think they don't have coverage or that it's ended already. And it's not that they necessarily changed anything, or maybe it's because they are now working or making more money than they were when they initially enrolled, or they just haven't heard anything from the state, but they think they don't have coverage any longer. And the reality is that because of the public health emergency extension, they should. And so sometimes it's just talking to them and relaying that you can help them, one, confirm that they still have coverage, and two, help them kind of navigate what are their next steps to accessing that coverage, whether it's working through their HMO, finding out who their HMO is, and two, also getting them to understand what options they have to access, because a lot of times folks might have coverage because they know they should or it's required, but many folks don't understand that there are plenty of opportunities to access preventative care, or, as I mentioned, dental and vision, which is sometimes hard to come by, but they're these huge benefits that people should be accessing, especially if when it does come time to renew and they might need to transition to different types of coverage, they might not have access to those benefits. So more than ever, people should be utilizing the care that's meant for them to use. And then I want to talk about regional enrollment networks. So if some of you have been doing this work for a while, you may be familiar with the regional enrollment network model. They started back in the first open enrollment period when the Affordable Care Act was put in place in our state. And they were groups of enrollment assisters and other organizations coming together to address this big change that was healthcare.gov opening and people having a new option for health insurance coverage. And it was originally formed in partnership with Department of Health Services covering Wisconsin and the Wisconsin Primary Healthcare Association. And they were based off the income maintenance consortia regions. Well, this time around, we are taking advantage of this new virtual world that we all live in, and are able to communicate widely with partners statewide and consumers statewide to build enrollment networks that hopefully will then be sustainable even past the public health emergency ending. And right now, we have two that are already, that really have maintained themselves throughout this time since 2014, which are the East Central and the Milwaukee Enrollment Network, but are now forming 7 new enrollment assisters beyond those two, covering Northwest, Northeast, Western, Northwest, Central, Southeast, and the Latino Enrollment Network. The Latino Enrollment Network is the first of its kind, which is an affinity enrollment network to hopefully support bilingual and enrollment assisters that are also focused on working in the Latino community, because it is one of our fastest growing communities in our state, to make sure that we have the support needed to make sure that our consumers know this information, have the resources to renew or enroll, and really that we're building a capacity for our enrollment assisters to thrive in this work. And what enrollment assisters allow us to do is that it helps keep local partners informed on policy and changes that are happening statewide. It helps build enrollment assister support and capacity because a lot of times we can identify trainings that are needed specific to that region. We're also able to provide that peer-to-peer support when it comes to complex cases and other issues that happen, especially if they're more common based on the type of area you live in, whether it's rural or more city, or in the case of the Latino Enrollment Network, if you're dealing with more cases that are focused on immigration or those other types of barriers and challenges. They also allow us to organize and streamline local outreach. It's one way that we can create those postcards and materials to have it cater to a region, and the region would then get to decide, who we're referring to and how we're able to connect people to really the right sources right away. We can create regionally and culturally relevant messaging. One example of this is that our health insurance literacy team right now is already talking to some of our regional partners to make sure that any information that we create moving forward has the lens of the needs of that community. And that helps because not only does that make the information easier to share, because the enrollment network themselves are committed to that messaging, but because the area, you're a part of that area, most likely the consumer will also resonate more with that information and how it's being shared. And then my favorite part is that the Department of Health Services is very committed to working with us at these enrollment network levels. And so that means that provides open communication between our local partners, all of you, and the Department of Health Services and other statewide partners. And that, bilateral communication is crucial because we're going to face challenges, we're going to see patterns, we're going to see trends, and it's fine if we identify that, but it's even better when we can come up with solutions with our partners to make things better and address it so that maybe they don't become ongoing problems throughout this process. And then I can't emphasize enough staying informed. As I mentioned, enrollment networks would allow you to stay informed regularly with your colleagues and partners in your area, but Covering Wisconsin also hosts an annual statewide conference, and it will also be virtual this year. So this is our health insurance enrollment conference. We have pre-licensing sessions for new enrollment assisters, so people who are trying to become new navigators, new certified application counselors. They can get all of their needed credits through this conference, and those dates are September 14 and 15 from 9 to 12. And then general sessions are 9 to noon, September 28th through 30th, and October 3rd and 4th. And those sessions provide the continuing education needed for enrollment assisters to maintain their licenses and navigator status and certified application status, certified application counselor status throughout the state. And we work closely with Department of Health Services and the Office of the Commissioner of Insurance to ensure that those sessions do provide the credits that are required. And it's another opportunity to meet key partners across the state. There's usually opportunities to get to know folks that are in the sessions, as well as get to hear the things that have become trends and concerns, and or just our information that it's crucial to know in order to do this work. And then making sure people can find you. I said this earlier, and one of the easiest ways to make sure people can find you is getting connected through See that? Getting connected through our connector tool. So as an enrollment assister, you have free access to be listed on our Get Covered connector tool. And you can also add appointments. So one option is to just have your contact information listed, but even more recommended and better for the consumer is to actually have appointments listed, and they can be virtual and or in person, depending on your preferences and your availability. But we do recommend that folks complete this form in order to share your interest in either a free tutorial or being listed on our Get Covered connector tool. And I would recommend folks, if you had been listed in the past, to just double check because things change kind of in the background. We still work with the Young Invincibles in order to make sure we can use this system. And so if you have been listed in the past, I would just recommend checking to see if you're still listed, and reach out to me if you're not, and I'll make sure to get you back up on our connector tool. But it's a huge resource for our assisters, and more as people are more comfortable using online services, this is how they find us. And so I really recommend enrollment assisters to consider being listed on our tool. And I'll just, sorry, could you go back, Courtney? Thank you. I also just want to make sure that when people call 211, because that is a resource that we use across the state for consumers who just want to call in, a lot of times our 211 partners are trained to use the connector tool to find local assisters. So if they're calling 211, they're using this resource. All right, so this one, I had to make sure that this was still around, and I'm so glad to see that it is. There have been several enrollment assister partners mentioning that they're out of practice using Access, whether it's because they've helped a lot of enrollment they've helped a lot of consumers sign up for health coverage, and most of their time may be dedicated to healthcare.gov enrollments, or when they see people who are eligible for Badger Care, it's because they're eligible for both. Or it could just be that they helped people sign up for Access earlier in the pandemic and they haven't seen them again because they've been able to extend their benefits throughout this whole time. But all in all, I'm hearing the same thing. I don't use Access as often as I should. And this is a great tool to essentially, from start to finish, see how to put in an application. And it's not something that's processed. It's all meant to be for training purposes. You can create a user account and go through the application. And it's an awesome tool. I used it when I first became an enrollment assister, and now it's still available, and I really promote the use of it, at least in the meantime, as we wait for the public health emergency to end. And then I want to continue to emphasize the My Access app and what can be done. I view the My Access app as a way to empower our consumers, because they then have the access to check their benefits, see their renewal date, which will be huge when the public health emergency ends, upload verification documents as quickly as taking a photo of the document, check the status of their benefits, and then pull up their Forward Health card. And that's all just on their phone. And at this point in time, many consumers have a smartphone. So this is their opportunity to be a little more involved in their benefits and their coverage, and know, what to look for. Since I've been doing some more recent enrollment, outreach events in the community, I'm always super happy to hear that many consumers already have this downloaded on their phone. And I think it's a huge asset to be able to quickly look up kind of what's going on with your particular case and your particular coverage. I will say consumers cannot renew or apply through the app. They will still need to go through access.wi.gov. But like I said, there's still so many opportunities and tools that can be used through this app that it still is highly recommended that they engage with it. All right. So now we're going to get into some additional resources and tools. Screening resources. There are a few screening resources that are available to help consumers kind of see where they're at if they just need a very brief overview of what they might be eligible for. Access.wi.gov has the Am I Eligible tool, and then Covering Wisconsin has our 2-question tool, as well as the new live chat that we'll talk about in a couple moments. But the live chat also has a screening tool within the chat feature. Oh, yep, and this is where I'm talking about. We're here to help. Covering Wisconsin staff are here to both help consumers, but our partners as well. And as I mentioned, the connector tool earlier, people can enroll or set up an appointment to enroll in coverage right away. Or as I mentioned, it's not just about enrolling, it's also about understanding your coverage, asking questions about coverage. So really, if people know or have a question in general, they can reach out to us. And if you're working with us, we will also get them to you. That's a huge thing that people might not realize, is that we're relying on a lot of our partners across the state, especially when consumers prefer a local experience. And we also have a new feature on our website beyond the connector tool, beyond calling directly to us. People can now text and or chat on our website with a navigator. And like I mentioned, it allows them to do a quick screener of what they might be eligible for. It allows them to ask for a callback if that's what their preference is. And then ultimately, it allows them to do one-on-one chat with a navigator. And we currently have 1 to 2 navigators on each day, Monday through Friday, from 9 to 4. And so this is a tool that you can start to share with consumers and with your colleagues. And I know I talked a little bit about this, but I can't emphasize this enough. With a new change, like the public health emergency ending in the future, we know that that is also another opportunity for people who do scams to create more scams. And so we want to make sure that people are on high alert with this transition to help folks avoid getting themselves into a scam-like situation. And so, of course, always promoting our services, all of your services, to get free, local, unbiased help, and that coaching our consumers that help should always be free, because it should. And then, of course, helping consumers ask some key questions to make sure that they're not being tricked into anything, specifically like, are you licensed or certified by the state of Wisconsin or the federal government to provide insurance help? Can I have your license number or see your certificate? Those are good questions for consumers to ask in order to protect themselves. Usually because if someone is trying to do anything faulty, they will hang up at that time. Because if they have it, we are able to provide those numbers to people. And then, are you showing me all of the insurance options available to me? Because that's also another indicator that they're one of our enrollment assisters across the state, that they're licensed with all of the qualified health plans that are available, and that they know the variety of options that are available to consumers. And then I cannot emphasize enough, healthcare.gov, 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 access.wi.gov. Because if people end up on healthcare.com, healthcare.net, healthcare.org, a lot of times it will get them to a point where they are getting phone calls every hour on the hour from different folks from across the country. There's a lot of other complex sites out there that are trying to essentially mimic healthcare.gov, but we know that there's only one, and we want to make sure that they're getting onto that right site. And then you can report scams to the Wisconsin Department of Agriculture, Trade, and Consumer Protection. And we really recommend that you do that if you do encounter a consumer that comes to you after being scammed, and you have to help them, because we really want to make sure that we're getting all those potential scams out of there, because we want to protect our consumers. All right, and then as we have talked about, as it pertains to regional enrollment networks, that each region, each community is different and is unique. And we have enrollment assisters that really know their audience. You guys are the experts in doing this work and delivering it to your community. And so we've had some creative ideas shared with us about how they're already getting the message around the public health emergency out into the community. For example, contacting existing clients to share information over the phone or during home visits, sharing Covering Wisconsin social media posts, adding this topic to discussions at community events, articles in the community, newsletters, local papers, posting flyers and the outreach postcards in their office, and presenting to community members and other partners. It really does take a village. It takes all of you doing this work across the state for us to make an impact. And I just appreciate that I'm a part of this bigger network in doing this work, because without you, I know that a lot of folks will go without knowing what to do next. And I really don't want that to happen. So I'm so glad that all of you are on this call with me today. All right, and then just a couple of takeaways. And it's a trick. We've already gone through these. These are the key messages that I told you I want you to take away around consumers and partners. And that's keeping your contact information updated, watching for letters from the Department of Health Services, because we should be opening our mail, and knowing what to do next with the information that we're given, and then getting free and local help from an expert like you. So those are our takeaways for consumers and partners. Oh, and the first one, of course, is no one will lose Badger Care and Medicaid benefits before the public health emergency ends. That's the number one. And then the action steps for enrollment assisters are really your takeaway. And so it's building relationships and communicating with consumers because they trust you, having conversations about using care now, because they have benefits that are available to them and we want them to use them, because the healthcare is important. That's why we actually do this work. It's not the health coverage. We know that health coverage is the foot in the door to getting the healthcare that they need and hopefully living a life that's healthy and thriving. We want to find out about community events. I challenge you all to take the next week to identify at least 1 or 2 community events that maybe you could participate in over the summer. Get involved with your local enrollment network and stay informed. So in the evaluation, you'll see that you can say yes to participating in your local enrollment network. And I really encourage all of you to do so. And I will get you connected to the lead enrollment network coordinator in your area after you give me that, that thumbs up. Make sure consumers can find you. Let me know if you want to be connected on the connector tool. And then practice using the access.wi.gov training website, and then the My Access app. Get that on your phone. So with that, I think we are going into some questions.
All right. And coincidentally, our last question that we just received before you started this, Caroline, was about how to sign up for getting involved with those enrollment networks. So that was good timing. And to the participant that asked that question, I will put the evaluation link in the chat in just a moment, and we'll also send it out afterwards so that so that you can answer yes to that question that Caroline just mentioned about learning more about your regional or affinity groups like the Latino Learning Group. And we can get you connected to those contacts. So great question. And thank you for that one to start us off. Please feel free to continue putting your questions in the chat. We have a good amount of time still for questions. Caroline did a great job taking her time, but also efficiently getting through all of the content. So please feel free to keep entering questions into the question and answer box. I will start us off with a question we got early on just about how the Department of Health Services is sort of redistributing those renewal dates across that 12 to 14 months. So the question is, with renewal dates being scheduled over that 12 to 14 month period, is there a specific course of action when deciding kind of who receives those renewal forms and when? Maciel, our partner from Department of Health Services, just shared some reminders that the department certainly is seeking to redistribute renewals in a way that is most effective for members in getting through this process. So we'll certainly be trying to align food share or other benefit renewal dates, for example, as a part of that process, and then also seeking to evenly distribute those renewal dates as much as possible from kind of a workload perspective for IM agencies across the state as well, to help with the processing of those renewals as well. So those are a couple of the kind of guidelines that the agency is keeping in mind when redistributing those renewal dates. Caroline, did you have anything else to add to that one?
No, I think you covered it, and Maciel covered it. Thank you.
Yeah, thanks, Maciel. And then we have a couple of access-based questions. So Caroline, I'll kind of defer to you on some of those, and then also we can also take some of those back to follow up on afterwards. I know there's some more kind of specific functionality questions. So the first one is just what that renewal process looks like through Access, and specifically if we can upload verification documents at the same time through Access when completing a renewal. And then why don't we start with those, and then we'll go to the third part of the question.
Yeah. So I will be honest. I also have not done one in a while because we haven't had to, right? So I'm only using my context memory to help answer this question. But my memory holds that it is a simpler process to renew on access.wi.gov. Usually it's requiring the person to log in. And when you are logged in, it says that you're up for renewal, and then you check your case, and then it has you answer some questions. It's not as lengthy as the full application is, but there might be some things that you need to change and update, like job information, income related information. It might verify that you're still living where they have you listed as living, which is one of those reasons why it's so important for folks to be updating that information now, and making sure that their contact information is updated. And then finally, if there's any other questions that they might have, those will pop up. And it should be that you are able to upload any required information, usually around the job piece of it. Usually it's uploading like either proof that you are still working where you said you were, or if you said that you are working somewhere else, proof of when you ended the previous employment and where the pay stub of the current 30 days of where you are working now, to just show that updated information. But it is typically more of a condensed version than a full enrollment. I hope that helps address your question.
Thanks, Caroline. That's a good overview. And then there was also a third part of that question about if a member has coverage now. can we kind of step through the application and update information? And I know we kind of touched on this a little bit on our last webinar too, around the importance of continuing to report changes throughout this process, and that you can report changes through Access. But do you have anything else that you'd want to add to that for kind of what folks can do or should be doing now to update information?
Yeah, and then I think it's not necessarily going through the application to make those updates, but making updates as they happen. It's recommended by the state that folks make changes to their case 10 days within that change. And so we do promote that, and that is as simple as going on access.wi.gov. And I think there is a button similar to like in healthcare.gov where it says report a change or, update information, which would allow you to do that.
Great, thanks, Caroline. And then just one more question about Access and some functionality in the past. So in a previous version of Access, the requested verifications were not always accurate, and the IM agency would frequently need to clarify which documents were really necessary. And the question is whether or not that functionality has been improved to reduce confusion or barriers. I don't know if you know that yourself, Caroline, or otherwise that could be a question that we could take back and have DHS look into as well.
Yeah, so I don't have the specific answer to that question, but I know it has been shared with our partners at the Department of Health Services. So they're familiar with this particular concern, and we can bring that back and see kind of what the status of that is moving forward. We're hoping that that can be addressed or at least looked at.
Great, thank you. And it sounds like if that's a trend that you all have seen, that would be a perfect thing to send through to that DHS Forward Health Partners mailbox too, which I can put in the chat in a moment, those sorts of issues. All right, so this is a question about the Am I Eligible tool. When using the Am I Eligible tool, when it asks for medical costs, do we include the amount that the person is paying for health coverage, like a Medicare premium, or if they have commercial coverage, that premium, or just the actual medical provider charges, so like out-of-pocket spending costs?
And I'm sorry if I'm not sure what tool specifically you're referring to, because I did talk about a couple of.
I think it's the Am I Eligible, that screener that's on the Access website.
Okay. So I would say actual medical provider charges in that case, not necessarily the cost of current coverage that they may have. But if Maciel has a different answer to that one, but that would be my understanding, was actual medical provider charges that they may have accrued or expect because of upcoming procedures.
Sounds good. And that's one we can certainly take back and clarify with Maciel too. So thank you for the question. The next one is a really great outreach question, and something that we've been actually considering in our DHS OCI outreach and education work group. So I'm not sure this is an anonymous question, but if you are interested in problem solving some of these really important issues to this person, please feel free to reach out to me, and I would love to have you join our outreach and education work group to talk through some of these challenges. But the question is, how do people experiencing homelessness receive their renewal if they don't have an address? And I know this is something, like I said, that kind of we as an outreach community and enrollment assistor community have really been thinking a lot about, and also something that DHS has been considering. I know one strategy that we've all been trying to employ is working with many of our partners in the homeless services community. So thinking about ways that we can make sure that service providers are also aware of this upcoming change and what they can do to help folks get connected to this information when they have some of those key dates, helping folks know that is the point when they would need to check their mail. And for example, if folks are using a temporary address, maybe a shelter or the IM agency itself as an address where they receive their mail, a job center, or another temporary location like that as a place where they receive mail, to try and keep that updated, and to check that location when the public health emergency ends and this important letter will be coming out. But also connecting with folks like us in the community who can help folks use other tools to find out when their renewal date is and when they need to take action. So just a few different thoughts there. Caroline, do you have anything you'd like to add to that one too?
No, I think that's well said, Courtney.
Thanks. Great question. And again, if you are interested in kind of problem solving issues like that, I would love to talk more with you. So thank you for raising the question. This next one is are there any training tools to help consumers through healthcare.gov? So similar to the kind of training site on access. Are you aware of anything like that on healthcare.gov, Caroline?
So there's not a specific training site for healthcare.gov, which I wish there was. That's a great question. But I can tell you at least some ways that I've troubleshooted through the process. One is I have my own personal healthcare.gov account. And the first application I do at the start of every open enrollment period is my own. And it's at least one way to see if there were any immediate changes that they made to the process of the website, and just to see if, if there's any questions that I wasn't expecting. And frankly, for the last few years, the application itself hasn't changed much. In comparison to those first dreadful techie nightmare years of the marketplace. And then I would also say that using the C plans, so healthcare.gov /C-plans tool, which is where you can put just general information about a household, so household size, income, if any of the folks are already enrolled in Medicaid, that's a great way to then look at the plan piece. One, to get estimates for the consumer that you might be working on, or just to practice looking at plans to get an understanding of what to look for, go through the resources that are available under each plan. But I don't want to digress because since this is so focused on Medicaid, but those would be the tools that I would look at least to get a little more acquainted.
Thanks, Caroline. And then this is a really important question about folks who have had their coverage maintained during this process. So this is about a specific program, but the question is if undocumented women who got insurance through their pregnancy would be financially penalized for staying on their insurance through this process. And this individual has one patient in particular who's worried. And fortunately, the answer to that question is true across the board of programs where folks' eligibility has been maintained throughout this process. If a full list of programs have been maintained, so even folks who have had emergency services, Medicaid during this period, for example, or may in this case be on Badger Care Plus prenatal, that coverage has been maintained through this period. Consumers will not be financially penalized for continuing to use their coverage and to stay on their plans during this period. I think there may have been a clarification to that actually added to the handbook relatively recently, Caroline, but I will also put in the chat, there is a member-facing website that DHS has been maintaining throughout this period as well, and it has the list of the Badger Care and Medicaid programs that have been impacted by this continuous coverage provision, and some FAQs as well. So if you have questions about particular programs and if they are a part of this continuous coverage provision, that sometimes can be a helpful reference as well. Caroline, do you have anything to add to that one?
Just to sum it up as no, the consumer you're working with does not have to worry about being financially penalized for staying on coverage because she is essentially, she has the ability to maintain that coverage because of the public health emergency.
Exactly. Thank you for summarizing. And then this next question is about the conference. Are you able to attend the conference for the 8 annual required CEUs for OCI? My information is the credits need to be reported to OCI by October 1st, and yours runs the conference to October 3rd. I think you can probably clarify that one, Caroline.
Yep. So we work closely with the Office of Commissioner of Insurance. So they are aware of our conference, they participate in our conference, and know that folks that are attending our conference are doing so to get those annual CEUs, those additional continuing education credits. And so they typically will honor that. And we will let you know if for some reason they don't, but it's been proven year in, year again that they will honor those who are in attendance to our conference to make that specific deadline.
Thanks, Caroline. And we only have one other question right now, so we do still have a bit of time on the webinar. If there are any other questions that folks have, please feel free to go ahead and enter them in the Q&A. Our last question is just more of a kind of statement about an interest in presentations for consumers that are being given. So I can share that many of our navigators through Covering Wisconsin and our partners have been out in the community sharing important information about this, like Caroline mentioned, at events and sometimes through consumer-facing presentations, but that's certainly a helpful suggestion to keep in mind too as we get closer, that we will share broadly any opportunities that we're aware of that are more consumer-facing presentations on this content.
Definitely, and I'll just also then emphasize too that those one-on-one opportunities for education are super important. And as nice as the idea of a larger consumer-facing presentation might seem, we know that this information is complex and each individual's case and situation is different and can quickly be overwhelming with generalized information. So I just cannot emphasize how important all of your roles are in working one-on-one with consumers and being out in the community to address questions that individual consumers might have.
Thanks so much, Caroline. All right. I'm not seeing any other questions, so I will go ahead and put the link to the evaluation in the chat right now. We'll also be sending out the slides afterwards. I will give folks, a few more minutes to ask questions if you have them while we still have some time. But thank you all very much for your time and attention today. I know this has been a long hour, but hopefully some good, helpful information and some great questions. Last call. Here we go. We got another one. All right. This is about scams. Great. And this is more of a comment from some of our partners at the Office of Commissioner of Insurance. So thank you, Monica. We had mentioned that scams can be reported to DATCAP, which is certainly true, but the Office of Commissioner of Insurance would also like consumers to file complaints if they have them specific to kind of agents or agencies and misrepresentation about coverage from an agent assister perspective, when those situations may be happening, so that OCI can investigate them. So thank you for that plug as well, Monica. All right. Not seeing any other questions. Thank you all so much for joining us. We do have, oh, here's another question. One more. So Caroline, this is about submitting applications on Access. So are we allowed to submit an application online for a consumer via telephone?
So obviously with the pandemic, this has been the reality that we've all used. And yes, with that note or caveat that in the application itself, it says that if you are applying on someone's behalf, and so to do so, to answer that question, saying that you are from a community-based organization helping this individual submit this application. That's an important piece of it. And that you are relaying all the information that's available on the application to the consumer as you're going through the process is also very important.
Thank you. All right. Well, if you do have any other questions that come up for you after today, Caroline's email address is on the screen here. And we will also be sending out these slides and the recording after the webinar. Thank you all again. Thank you, Caroline. Thank you, Maciel, for your help with the questions. Have a great rest of your day, and we will talk more soon. Thank you for all the work that you do.
Thank you so much, everyone.